One. It's social distancing at the chamber. My name is Garrick Taylor, as always, joined by the CEO of the chamber, Glenn Hammer, a little segment we call Happy Hour with Hammer. Glenn, we have been very fortunate in these segments to have special guests. Tonight is no different. We're joined by special guests who can give us some insight into what's going on in the world of diagnostic testing. So Glenn, I'll hand it over to you to give our guests a proper introduction.
Well, we're very privileged to have Dave Dexter, the president and CEO of Sonora Laboratories, on with us today. He's the CEO of, to me, an incredibly important company and a good company. I think a lot of us have used, including myself and my family, all sorts of different tests from Sonora Quest, and I've always had a great experience. I don't know if there's 7 or 8 billion people in the planet, and I say this sincerely. Dave Dexter is the person I trust the most when it comes to all issues related to testing. We're honored to have you on the Arizona Chamber of Commerce and Industry Board, Dave, and thank you for joining us today.
Thank you. It's a pleasure to be here. So maybe I'll give a little bit of a background on my company and some of the hats that I wear.
Sure.
I'm a general manager of joint ventures for Quest Diagnostics, which is a Fortune 200 company. Quest is the largest clinical laboratory in the world. And I serve as president and CEO of Sonora Quest Laboratories, which is a joint venture between Banner Health, which is one of the largest secular, non-secular systems in the country, and the largest health system in Arizona, and Quest Diagnostics. And Banner has a 51% interest in the joint venture. And then I also serve as president and CEO for Laboratory Sciences of Arizona, which is a wholly owned subsidiary of Banner Health, a nonprofit which manages the 30 hospital laboratories, 17 of which are in Arizona and 5 outside of Arizona for Banner Health. And then in my spare time, I serve as the board chair for Health Current, which is the state health information exchange. And I've been a founding board member, which was probably 12, 13 years ago, and served as board chair for the last 8 years. And then I think relevant to that is I'm also on the National Leadership Council for the eHealth Initiative, which is charged with trying to connect all of the disparate health information exchanges across the country. So what this does is affords me a very broad spectrum, comprehensive view of the healthcare system. And of course, with the COVID outbreak, laboratory is really at the epicenter of that. And it's certainly at the forefront in terms of the management of the COVID crisis. So, you know, kind of going back in time, 5 months ago, there were no COVID tests in the United States. And as a matter of fact, the ones that were available even in places like Korea and China, et cetera, were early stage tests, and frankly had a lot of false positives and false negatives as well. So as this started to expand in the United States in February, you know, as laboratories, we began to become very involved in communications with the diagnostic manufacturers, such as Roche Diagnostics and Hologic. Roche, even today, does 50% of all of the COVID testing in the United States in terms of their own supply chain. And they are a valued partner of Sonora Quest as well. So we were, of course, through Quest Diagnostics, early on very involved in terms of what was happening and not happening at the national level. So as you know, CDC developed the first COVID test, and they only allowed public health labs to perform that test. And it wasn't a PCR test. It wasn't a very good test. It had a lot of problems and issues early on, which then, as the prevalence of the virus started to grow in the United States, put a lot of pressure on CDC and NIH then to allow diagnostic manufacturers to go through the process of developing not just PCR tests, but also allowing labs to develop lab-developed tests as well. But it happened so fast with the outbreak in the Northeast that they had to do something really significant. And that was allowing the FDA to grant emergency use authorization to diagnostic companies as well as laboratories to start doing testing as soon as possible. So, you know, the governor declared the emergency, I think it was on March 11th. Sonora Quest was actually in the second wave, just behind the major national laboratories to introduce a PCR test. PCR stands for polymerase chain reaction. It's a gene amplification technique that is extremely accurate, very sensitive, very specific. And it is a gold standard for detection of the virus. So we introduced our test on March 17th. And then it was kind of interesting. We expected the demand for that test to be fairly significant. It really wasn't through March and all through April. And that's because the Arizona Department of Health Services, in conjunction with the health systems here and CDC, identified prioritized groups, which were inpatient, emergency department patients, healthcare workers, and first responders. And as a result, we had, working with Roche Diagnostics, a capacity of PCR testing of about 5,000 tests per day. But through March and April, we only had orders for 1,000 tests a day. In the meantime, I wanted to test long-term care. You know, I have a passion for long-term care, and I think it's really underserved in many ways. And Sonora Quest is really different than, say, the national laboratories because we serve the entire continuum of healthcare. Sonora Quest, along with LSA and our partners, Pathology Specialists of Arizona, that represents the largest integrated laboratory network in the nation. 3,500 employees that we have, and nearly 120 pathologists of every specialist you can think of, numerous PhD specialists. So we have enormous technical capability, and you know, frankly, have built a very strong culture based on innovation. And we have some of the most cutting edge innovations in the laboratory industry, some of which have not even been released yet at this point. But as an integrated laboratory network, we're served that entire continuum of care, from inpatient to outpatient to outreach to direct-to-consumer. We're the nation's leaders in direct-to-consumer testing, to long-term care, to serving all of Medicaid, all of the federally qualified health centers, and Indian Health Services. So you name it, we serve it because our philosophy has always been, we're not going to serve just the most profitable segment. We're going to serve everybody, and we're pretty proud of that. So, and we know that we make a pretty significant difference. So as an integrated laboratory network, Sonora Quest Laboratories is a core lab. A core lab is much different than the national laboratories because we're open 24/7, 7 days a week, 24 hours a day. We have to because we serve all the banner hospitals and, frankly, other healthcare systems in the state of Arizona. So it gives us a broad scope of testing and capabilities to serve everyone. So long-term care was really an underserved segment. It's one of the ones that I felt strongly should have been in the prioritized groups. I lobbied heavily for that. It didn't happen. But in April, I finally connected with Dave Voelkel, who's Executive Director, CEO of the Arizona Healthcare Association, ACA, which oversees long-term care skilled nursing facilities. And together, we has to plan to test all of the skilled nursing facilities. And as we went through that process, we also realized, I realized that we were going to need a management tool for long-term care to allow the individual facilities to manage their residents safely, and also the staffing of their facilities. And we also wanted a tool that could be easily used by ADHS to help manage and monitor those facilities, and also the state health labs. So we developed the long-term care dashboard, which I think is pretty revolutionary. And we finally reached agreement with ADHS in I think it was late April, to test in May. And so we tested all of the long-term care facilities, all the residents, and all of the healthcare workers during that time frame. However, there was another thing that occurred that was completely unexpected, and that was many people, including myself, believe that this is Arizona. You have a virus that has been shown to die in direct sunlight in 1.5 minutes at 75 degrees Fahrenheit. And we know that the flu goes away every summer because of the heat, but that didn't happen this time around. And it really caught everyone, I think, flat-footed. So I was expecting that we would see a significant decrease in PCR testing in June. And I thought we would see an exponential increase in antibody testing for COVID. The exact opposite happened. And so, you know, I recall vividly being up at Lake Powell on Memorial Day, and elbow to elbow with every person who wanted to get into the outdoors. It was an absolute zoo. But it was a real eye-opener, because I realized that there was so much pent-up demand from being cooped up that everybody wanted to let loose, and they did. And so on Memorial Day, we had a positivity rate for PCR of 4.5%. In the succeeding weeks, it started rising significantly. So it went to 10%, then it went to 14%, then it went to 18%, then it went to 22%, and then hit a high of 26%. And of course, that put the governor and his task force under a lot of pressure to really do something. And he's had to kind of moderate the opening state, and I think that was the right thing to do. And we seem to be now on a pathway where it is moderating. I can tell you that right now our PCR positivity rate the last few days has been in the 18 to 19% range, which is definitely on a downward trend. On the other hand, our antibody positivity rate is now around 14.5%. It was 3.5% back before Memorial Day. Now, you would expect that because of the increased prevalence of the virus, and more people getting exposed, therefore more and more people are going to show a positive antibody test. So in late June, as it was around June 19th, as this was really starting to get away from us. Of course, nationally, there was a huge pressure in terms of not just on reagents and instrumentation and the supply chain for these types of tests. You simply couldn't buy an instrument or more reagents. So even though Sonora Quest sought to increase our reagent allocation with Roche, and then we later developed Hologic. We have 5 Panthers that we can use, but there's only so much reagent to go around. There are no more instruments in the supply chain, and there won't be until probably after the first of the year. And oh, by the way, then there was the issue with collection kits on the nasal pharyngeal swabs. There was a worldwide shortage of those. And now that has largely moderated, and I can tell you that while they're not easy to get, we can obtain them. So that's not really a problem. So around June 19th, I came up with an idea and a plan to increase Sonora Quest's PCR testing capability to 15,000 tests a day. I thought that, given the circumstances and the lack of availability of reagents and equipment, was a pretty darn good plan. And I presented that to ADHS and to Banner Health senior management. And it was greeted by, stoic stares. They said, well, what we really need are 60,000 tests a day. So that was a pretty sobering moment for me as I walked out of there, because I had no idea how we could possibly get to 60,000 a day. And so I went home. I had what I call one of my white wine nights, where in my career, this is my 21st year as CEO, and I had the battle scars to prove it, by the way. But through those experiences, I've learned that there's always a solution. And you just have to keep your brain working and be open to lots of different possibilities. So that night I came up with the idea of Operation Catapult. And the intent was to find a way to catapult Sonora Quest ahead of all the PCR demand in Arizona to really get us to 60,000 tests a day, which seemed like an impossible task. So without even consulting my senior team, I called the CEO of Euroimmune, one of our partners. They're our company that we use for antibody testing, and they're one of the 16 authorized antibody tests by the FDA. They have an outstanding reputation worldwide and been a great partner. When I called the CEO, I told him what I wanted to do. I needed his help to support us with reagents. And what I wanted to do was use open platform instrumentation from different manufacturers to put it all together in one line and make it work. He thought that was an ambitious undertaking, to say the least, and he said he'd call me the next day, and he did. The very next morning, he called me and said, you know what? Sonora Quest is really a valued partner. You have a national and even international reputation. You're the perfect partner for Euroimmune, and we're going to find a way to help you do this. Euroimmune happens to be owned by Perkins-Elmer, which is a large firm on the East Coast that has been in equipment manufacturing for as long as I've been out of college. So everybody in science knows Perkin-Elmer. And so the Perkin-Elmer CEO said they were going to support it too. And then we had to partner with another company called Analytica, which makes PCR instruments. So literally within 24 hours, on a handshake, a verbal handshake, we did what amounts to a $10 million deal. $8 million in capital equipment, $2 million in reagents, and it was all shipped within 48 hours. So now it's on its way to Sonora Quest, and I haven't even told my own team this yet. So we had that discussion, and I was greeted by a stoic stares again, like, is this even possible to do? And then I contacted Dr. Kara Christ at ADHS and explained to her what we were doing, and that I would need some funding from ADHS in order to sell this to the Sonora Quest board. So after a few nights of negotiating, she agreed to put $2 million in on the capital equipment. Then I went to the Sonora Quest board and asked for $6 million in emergency capital. And oh, by the way, the equipment's already on its way. In fact, some of it was already here. And of course, as a CEO, everybody has their limits of authorization on spend. But this is an urgent situation, an emergency. And Banner had told me, do whatever you have to do to make this happen. And so I did. And 8 days later, we had both ADHS as well as the Sonora Quest board approvals. And by July 4th, we literally had the first 2 lines starting to be assembled. So we got teams organized internally at Sonora Quest. We got Perkin-Elmer teams, and also representing Analytica as well, and Euroimmune. And we have been working 24 hours a day nonstop since that time. And so I can tell you that in the intervening time, our test backlog went to 65,000, which, as a CEO of the largest lab in the state, I'm not happy about at all. that meant that people had to wait extended periods of time in order to get their results. And the reality is Operation Catapult is all about getting ahead of testing demand and reducing test turnaround to 24 to 48 hours. And we want to do that because we want to enable contact tracing for ADHS, whoever may be involved with contact tracing. And quite frankly, we don't want patients to be waiting days wondering whether or not they actually have the COVID virus. So Operation Catapult is a very ambitious, very risky, because we didn't know whether if we put all these equipment lines together that they would even work. But again, we have outstanding technical expertise in our organization. I know their capability. And so when I give them an impossible task, they almost invariably succeed. And that's what I was counting on. So a week or so ago, we had a backlog of 65,000. I can tell you that the first 2 lines are up and in production. And we had a lot of workflow issues, as you might expect with that. We hired 215 people, both pre-analytical and analytical, because you cannot scale, to do something 10 times what you're currently doing. You have to have the physical facility, which we do, and you have to have the personnel and the technical expertise. So it's an incredibly complicated risky venture, but I can tell you that we're successful with it. So those first 2 lines, after we have gone through extensive, stringent quality control and workflow assessment, they are up to 50% capacity each line. So that's each line has a capacity of 6,000 tests a day. Each of them are doing 3,000 tests a day. They will be released today to go to their full capacity of 6,000 tests per day. We have a 3rd line that is in validation right now. It'll come out of validation most likely tomorrow. It will also be at the 50% production level, the same stringent QC and workflow assessments, but it'll come out probably faster. I would expect by Monday it will be fully on as well. We have a 4th line that is being installed. As I explained to Dr. Chris, we had a couple of PCR instruments that were hung up in customs in Tennessee. And so I requested ADH help to pressure FEMA to help get those out of custom. And as of this morning, that's happened. So the 4th line, like I said, is being assembled. I would expect it to be online fully by a week from this Friday. The 5th and 6th lines are on their way. We have a total of 8 lines that we have on order. And we would expect that the balance of the lines will be up and fully operational by the end of August. So what that means, in effect, is as of this Sunday, the entire backlog for Sonora Quest will be eliminated. And on Monday, we will have the ability to do 21,000 PCR tests per day. And by next Friday, we'll be up to, I think, probably 27,000. And by the following Monday, we'll be up to 30,000 tests a day. And by the end of August, we'll be up to 60,000 tests per day. We will make Arizona one of the most productive testing states in the country, bar none.
Dave, thank you. That is a lot of really important information. And by the way, you went through about all my questions, but I still do have a few. If you could explain how, so we've had this ebb and flow in demand over time. How do we make sure we get 60,000 Arizonans tested every day, and how should we be thinking about it in terms of prioritization? You mentioned long-term care. The other area on my mind right now, and this is personal, and if you hear any commotion, this is part of why I really want to see testing work, is because we've got 2 kids ready to go back to school, and it's time for them, if they can safely do that, but we've got a lot of understandably concerned teachers and support personnel. How could this 60,000 sort of be woven into some of the things that we need to get done to get this economy fully going again?
Yeah, so let's talk a little bit about the employer segment. As you know, Glenn, one of the things that we worked hard on is to develop an employer solutions dashboard. That is all ready to go, and we can help small to medium-sized companies in a very affordable way to help them into the return to work and the management of their staff. We had to put that on hold just simply because the demand for PCR testing was too much. But as we ramp up, we're going to be looking for the guidance of ADHS and also Banner Senior Management too, because we want to make sure that Banner has the opportunity to put in the testing algorithms that they think make sense for the management of people who truly have COVID. We want to have ADHS be able to give us guidance in terms of what types of testing should be used for which specific groups and at what frequency level as well. So long-term care definitely comes to mind there. I think we are going to have to test them at least once a day. I think we also are in agreement with ADHS that we need to test assisted living as well. I think you will see more use of the COVID antibody test going forward as well. And we have plenty of capacity on that. We're averaging anywhere from 2,000 to 3,000 tests a day on the antibody tests. We have the capability to do 7,500 a day and easy ramp up to 15 to 20,000 if we need to. So there's no issue with that. Now, when it comes to the schools, you know, that's a political hot potato. So I'm just going to tell you what I would do, not necessarily what anyone else would do. So we could agree on that. You know, I think that everyone is concerned. You know, I hear it from my grandkids every day too. They go to school and, you know, why can't you test the kids and the teachers? Well, you know, technically we could. Now, let's look at this from a numbers standpoint, though. You have 1 million or so kids in K-12 throughout Arizona.
Sure.
That's a lot of testing. You have, I'm not sure how many teachers, but what, probably 50, 60,000?
At least that, yes.
Yeah.
And then support personnel.
Yeah, so but one way that we might be able to do this is through a process of which we call pooling. While Arizona is not a state that I would recommend we use pooling for the general population because the prevalence is too high. So pooling, for instance, what Quest Diagnostic is doing at the national level is they are looking at specific geographies across the United States. So where the prevalence of the virus is less than 5%, and this could be, it might have 4 patients from all around the different country, doesn't matter, they pool the 4 specimens. And so now you run one test, and if all 4 are negative, then all 4 are good to go. But if it's positive, then you're gonna have to do 4 individual tests. So you see, it has to be very selective in order to be successful, but also improve the productivity of the test. And this is one way to attack the backlog, by the way, on a national basis, because the national labs are backed up hundreds and hundreds of thousands of tests. Just simply because the demand is so substantial. And by the way, when we start talking about some of the things that we're talking about here, where you're adding in additional testing, you know, that just simply is beyond the capability of the supply chain system to be able to handle it. So, so let's come back to the schools here. Even though the prevalence of the virus is high for adults, I think we could all agree that it's probably very low for kids. And in fact, Dr. Fossey just came out today, as a matter of fact, and said that the prevalence of the virus and their ability to transmit it for kids below 9 is extremely low. Now, they believe 10 and above, it's equivalent to adults. You know, but this all changes, you know, frankly, every day. But I do believe that the prevalence of the virus is really low in kids. So I think pooling is an option for kids. So let's say if we started this and tried it and had good success with it, maybe we would start out with 5 that we pool. And if it was really successful, we might go to 10 that we would pool. And you can see how the numbers could add up, where we could actually test the kids initially to make sure that they don't have the virus, and then do all the appropriate things if they do have the virus. I think for teachers, you absolutely must have them have a PCR test on an individual basis in order to give them a higher degree of confidence as they start out. And then I think there's going to have to be some level of frequency of testing as defined by the state. That I think is the best way to open it. Now, compare that with waiting until the prevalence of the disease in a specific geography or school district is below 5%. That's the other option that you have. I personally think the testing one is better. It's just that the US testing market does not have the capability to do that today. We might have the capability to do that in Arizona. That depends on what ADHS and Banner Health and others in the healthcare industry determine what testing algorithms should be used. But I can tell you this, as of Monday, Sonora Quest will have 1 to 3 day turnaround time for COVID PCR tests. And by the end of August, we'll have 24 to 48 hour turnaround time.
That's great. That's great. Garrick?
Dave, a lot of focus in the media on Arizona's specific situation. But if you talk to your colleagues across the country, have they experienced similar challenges that your company has experienced?
Oh, of course. I'm in daily contact with Quest Diagnostics. The Quest number 2 person is on my SQL board. So I'm very, very familiar with what's happening in all geographies. And I can tell you that in April, we actually built reverse interfaces with Quest Diagnostics so that Quest Diagnostics could offload work to us and vice versa if we wanted to do that. And in fact, Sonora Quest, to use some of the capacity in April and early May, was taking work from Quest Diagnostics in California and Washington and Nevada, et cetera, trying to help out. Because, at the end of the day, we're all in this together. And it wasn't until we really got into this increased demand that overwhelmed virtually all the labs in the country that put us in this position. The other thing I would share with you is this. You hear and see actually in Arizona where there is testing at collection sites that doesn't go to Sonora Quest or say to LabCorp. And you might ask yourself, well, how can that be available? And if it is available, why isn't Sonora Quest or Quest Diagnostics or LabCorp or Mayo or ARUP using these technologies? Well, there's a reason, because they don't work. You can get a result if that's what you want, but the laboratories like Sonora Quest and Quest Diagnostics and LabCorp and ARUP and Mayo, they validate every single technology they put into their laboratory. So we don't take a test kit that the manufacturer says this is the sensitivity specificity of the assay and accept that. We just don't. We have to put it through stringent quality control to validate it. And that's why when you had early on the FDA under the emergency use authorization, issuing all these quote approvals, emergency approval to use tests. So about 200 antibody tests showed up on the market from China and Korea and Singapore. And, every clinic, it seemed like in the country or pharmacy or whatever, suddenly everybody's in the laboratory business, not understanding that the test is not a test, the lab is not a lab, and a result is not a result when it comes to accuracy. So if the large laboratories could use those other technologies, if they were really good, we would use them. but we can. And so I just want to give you that perspective.
That makes a lot of sense. And just one point of clarification, you talked about PCR, you talked about serology. Is your company in the saliva sample business, or is that a separate entity that is being handled by ASU?
No, so let me say first of all that one of the things under Operation Catapult is we secured 1 million, purchased 1 million nasopharyngeal kits with total line of sight to millions more if we need them. On the other hand, if you're going to test kids, for instance, nasal isn't an ideal choice. And quite frankly, it's not very comfortable to have that collection made. So you have seen where there have been several laboratories, and ASU is one that developed a lab-developed test for PCR. And then they did a comparison with nasopharyngeal and saliva. And they determined that they were equivalent. In fact, in their study, they showed that saliva might even be better than nasopharyngeal. But that's with that one PCR test. And of course, it also depends on what's the cutoff level at the low end for your PCR test too. What's the stability of saliva over time? Because Sonora Quest takes specimens from every sector of the state. And so we need to make sure that the specimen is stable as well. So I can tell you that right now, one of our scientific directors is working directly with Euroimmune. And we're going to put our own study together to evaluate saliva versus nasopharyngeal. And if we can validate it, then we would put that into production.
I'm going to use a technical word here. Is there enough stuff available to do 60,000 tests a day for a number of months going forward once you ramp up? I mean, we're talking like through the end of the year, the calendar year, potentially.
Yes. You've heard Dr. Kara Chris note that the way Sonora Quest is doing this is going to put us out of this loop of having reagents and supplies being, ushered to other parts of the country. We specifically developed it this way through an open platform system to not put us at risk for that. So yes, we're very confident that with our supply chain access to everything that we can do that. As a matter of fact, I attended a meeting that the governor held a few weeks back where there were 15 of us, healthcare leaders that were invited. And we all talked about what we're doing here in the state. And Dr. Deborah Birx was there, and she really wanted to understand what we were doing. And so I, at the end, shared Operation Catapult. And, looking around the room, everybody was silent and everybody was wearing masks, so I couldn't really see what they were thinking. But Dr. Birx broke the silence with saying, that's really a remarkable achievement, to be able to get to 60,000 tests. And I certainly hope you can do it. But there's always a but. Our models at the White House show that Arizona needs 100,000 tests a day for the next 6 to 12 months. So, and kind of deflated again, when I walked out of there thinking, now how am I going to get to 100,000 tests a day? So, but that's just the way it is. But if we have to do that, we'll find a way to do that too. So whatever it takes in this pandemic, we have to be able to serve all Arizonans and help us manage through this pandemic, and not just from a healthcare perspective, but our employers as well, schools if we can help, long-term care, all of those situations where we have people who are highly vulnerable, the Indian health nations, etc.
Well, Dave, I know that you've worked this from every angle, from customs agents to, I believe, one of the companies, maybe is it a German company that?
It is. Euroimmune is a German company. That's right.
So I want people who are watching this to realize the extraordinary effort that you've put in personally to bring all of this together. And we thank you, and we want to help however we can make sure that this is success and we get the right people tested, and I'm convinced that this is going to be a major reason why we're going to get to the other side of this pandemic, and live with it until we get much better therapeutics and ultimately a vaccine.
Yeah, thanks, Glenn. And, I'm really indebted to the Chamber too, because you're so connected to everyone in business and everyone in the government sector as well. So I know that you and your team have used your influence to help us wherever you possibly can. Also want to thank Sandra Watson at the Commerce Authority too. She's been very, very supportive. So every place that I have looked and asked for help, I've gotten that. And so I'm very grateful for that too, because I know we're really going to make a difference for Arizona.
Dave Dexter, thanks for being on the show today.
Yeah, thank you. Thanks, Garrett.
Thanks, Dave.